So, my experience or relationship with cancer started when I felt a lump. I simply felt a lump on my breast. And I know so many women are affected and families are affected by cancer, but I didn't think I had cancer in that moment. But I did go right away, book my appointment to get a mammogram and checked out. Got the biopsy and waited, and I think I waited, not just a little agitated, but thinking it's going to be fine. I did my due diligence. I took care of this thing and we'll just move past it. And then I got a phone call, and it was the doctor. I'm sure he has a lot on his mind. I don't remember his name, and he certainly does not remember mine, because he simply called and said, "You have cancer. Find yourself a surgeon. Do you have any questions?" And I was so shocked in that moment, hearing that for the first time, "You have cancer," that I had no questions. I simply hung up the phone, and I remember I went directly to my bed, to lay down, which is a funny response, I guess. The first call that I made was to my friend, Dr. Susan Boolbol. What should I do? Well, I have no idea what to do right now. I was so afraid and in shock and just blank. I had no idea what the next step was, what to do next. And I was scared. Cancer. There's no one ever says you have a mild, small case of cancer. You have cancer. And it struck fear in me. And my impulse was to call um, my friend, who happens to be the premier, in my opinion, and consensus of the world, premier breast surgeon in the country, US, and the world. Um, and right away, the reassuring voice was on the other end. "We got this." That was the first thing. I'm going to cry. When you're so afraid and you have no idea what to expect, the reassurance that we got this, we're going to handle this. I'm going to book you here. I'm going to do this. You're going to get up here, to our hospital, and we're going to take care of that. And she did every step of the way. I was taken care of by Dr. Boolbol and her staff. They were caring, they were nurturing, they checked in, they were not just interested in the cancer, they were interested in my emotional journey through the cancer, and that they were going to be there every step and everything that I did not anticipate. They didn't frighten me with it, but they put in little spaces that there were catches. They didn't tell me how it was going to be, how difficult, because you never know. But they let me know that they would be there every step of the way, and they would give me the best care and the best aftercare, and to be there for that whole process. And that experience, the most horrible news anyone can receive, that journey shared with not just the most competent surgeon and staff in the country, but the most caring, empathetic group of professionals in the country, made all the difference. And I would have never known that wasn't the standard had I not had my previous experience on the phone. "You have cancer, figure it out. I have other stuff to do, hang up." That's the difference, between the care that I got and unfortunately so many other people did not get. Perhaps their cancer was removed, perhaps their treatment was successful, but cancer is so much more than just removing that. It's an emotional experience that requires a lot more skill than just that scalpel and chemicals. It's a human connection, and that is what I received. I was a human, and I think that makes all the difference in the world.
You know, I remember that phone call from you, and what I remember about it was it hurt me that someone called and just said, "You have cancer and find a surgeon." And unfortunately, that is what goes on all the time. And we've actually been trying to figure out the best way to tell someone, because the waiting is awful.
Yeah.
And there's no perfect way to tell someone they have cancer, but the way we know what's not perfect. We haven't figured out perfect, but we clearly know what's not perfect, and the way you found out was not perfect. And I think the important thing with this is, and I say it, and I know I've said it to you, is we're going to take your hand and guide you through this. This is what we do every day. We have a whole staff, a whole team of people, lots of physicians, nurse practitioners, PAs, nurses, social workers, nurse navigators, everyone there to take care of you. We do this every day. This is hopefully the first and last time that you have to deal with something like this. And there's just something different about breast cancer compared to other cancers. You know, no one ever wants to hear those words, "you have cancer." But when you hear that you have breast cancer, number one, it's all around us, because the sheer number of women and some men that get breast cancer, you know, every year it's over 260,000 women just in the United States. So these really are enormous numbers. So it's everywhere around us. The problem is, when we were younger, it was our friends' parents getting breast cancer, or our friends' grandparents getting breast cancer. And now it's us, and it's our age and our peer group. And so when you start seeing this happen to your friends, it becomes much more emotional. And there's something emotional about breast cancer and taking care of it. And I fully believe, and it's one of the reasons why I do this, is, and I said it to you, and I remember having the conversation, is this isn't just taking care of your cancer, this is taking care of all of you. And if you are taken care of in a certain way through it, it makes the after moment of realizing that you have breast cancer and everything that you've gone through a little easier, and you emerge healthier than if someone just took care of your breast cancer and not all of you. And I think it really makes a difference. Is there any standout moment as you were going through? I remember several not great conversations of news that I had to deliver along the way. And listen, you're resilient beyond words, defined by you being a professional athlete. So in short, you're resilient. You've been through lots. This is different. This touches your core, your soul, and everything in between. And as much as you've gone through, it's just different. It knocks you to your knees.
I will fully admit that. I think, people talk about mental toughness and physical toughness, and, moving through pain and emotional duress that comes from professional sports.
You've been through all that.
Yes, and there's no preparation for the cancer. I had no idea what to expect. Part of me there was a little, part of me that was arrogant enough to think that I wouldn't need support, that I could move through this alone. And you didn't force it on me, and you didn't do it in a frightening way, but you certainly said to me, "I know that you're this, this, and that, but here are some resources that are going to be available to you. And if I didn't take those resources, um, in our follow-up conversations, you would ask me the questions, how are you doing? How are you feeling? And if I would say, oh, I'm moving through this with this, or I'm moving through this with grace, or I'm trying to do, you're like, take all that away. All you're doing, if you're not doing it gracefully, it doesn't matter. If you're just moving through it, and you like removed a lot of my ideas of like self-reliance that we all need, but you were like, you have to lean into your help. You have to lean into your community. And right now, your community is me and my staff, and of course, your friends. And that was so, it was like wide open arms, whether it was a social worker, your head nurse, a physician's assistant, everybody was there, caring, as if I was a friend or a relative. Every time I came into the facility, every time I was in, whether we were taking blood or being, moved around to take a biopsy or filling out forms. Is that okay? Did you do that? Do you need help with that? That was, everything was, do you need help with this? Can I help you with that? And I'm a person that's, just not conditioned to ask for help. So sometimes I was asked 2 or 3, 4 times,
4 or 5 times.
maybe more, until it was like, you know what, I do need help. And I took it, and I needed it. I really did need it. And then to be okay, I felt very safe that I was being taken care of. When you think you can take care of yourself and no one can take care of better. I knew in that moment, this was an outsourcing of care, and that you and your staff were going to do it better. And I'm talking about the aftercare, obviously.
Right.
That aftercare was really critical. And that, I think, helped the healing. And because you're also left with a kind of a scar of fear, and that has to heal as well. This happened to me, and will it happen again? There was, going through the process, that the healing of the fear and the terror that comes with the cancer. So there, a lot of subtle, nuanced cares that I would have never anticipated. And even during the course of that, it wasn't until after it was like, wow, that was really remarkable. The anticipation of
Right.
things that could go wrong and that I would maybe feel. So many resources and so many really caring people that were not forcing it, but waiting until I was ready.
Right. And so much of what we do is reading the patient. And, we don't know the patients. I'm meeting them for the first time, but it's figuring out how to read them and what do they need, and getting them through this. And it really is our job. And it's emotional for you. And trust me, it's emotional for us. As I say, every time I walk out of a room with a patient, I leave a little piece of my heart there, because you've been through this. It's emotional. You're not just a patient to any of us in this field or in our office. You're someone who we are honored to take care of, because you've put your health in our hands. I mean, what's a bigger honor than that? You've taken your life and trusted me with it. That's amazes me every single day. And it's one of the things that keeps me going. It also keeps me up at night, but it keeps me going. Is this woman has put her life in my hands, and she's trusting me to do the right thing and to do the best thing. and it's an honor, and one that keeps us going and that we take super seriously. It still is mind-boggling to me that that goes on, and I think it's something that patients never think about, and 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 that's okay. That's not their job to think about it, but it really is. They don't think about it from the physician's viewpoint, but I don't know that you think about it from your viewpoint of, oh my God, who is this person? And I'm trusting my life with them. It's this really fascinating concept, and it's an honor to be able to do that. And I'm constantly shocked that people come in, they meet me, they have breast cancer, and they trust their life in my hands. But breast cancer or cancer, and I've used these words with you as many patients, it's bigger than any of us individually. And we're strong, independent women and not so good at asking for help. And I remember multiple conversations, checking in, saying, it's okay to ask for help. It's not a sign of weakness. You're still strong and resilient, and you're going to get through this. You just need help through it. And help's not a bad word. And thankfully, you did allow your community, your friends, your family, who all they did was want to help you. And that's what we see all the time. People's, patients with breast cancer, their family, their friends want to help. They just don't know what to do. So what would you, after going through this, knowing who you are, knowing how many people wanted to help you, what would you suggest to them? How do you help someone?
As a family member,
Family
as
member
a
or
friend,
friend? Right.
I think checking in is so critically important, and it's invaluable. There's, everyone thinks, well, I'll make a casserole or I'll send flowers or I'll just checking in that
Why
phone
is it
call.
always a casserole? I don't
I
understand.
don't
It's
know
always a casserole.
the go-to. I think checking in and it's an incredibly scary, lonely touch with your own mortality moment. And I think those checkpoints with the people that you love and care about, just that phone call is important.
Yeah.
I'm connected to you and I care about you. I think that was the most important. And just, to go back, of course, now that I have the experience of this, and then you have the telltale, you lose your hair and it grows back, that women will come up to you and say, oh, I have breast cancer as well. How are you doing? Or what kind of cancers you have? And it's always a whisper like that, like
Right.
it's a secret.
Well, no one says the word cancer in their normal tone. It's always cancer. We have to make it okay. And we don't have to whisper the word cancer or breast cancer, because it's not a bad word. Nobody wants it.
Right.
But look at you. I mean, you are thriving. Look at where you were, that initial discussion, to where you are now. And I think that's part of the fear, is wondering, will I get back to who I was? And I think that frequently the answer is no, you won't get back to who you were, because cancer changes all of us, but it changes your outlook. And for a lot of people, it's a chance, it's a second chance at life. It's like, oh my God, I had cancer. I'm going to do things different and better, and I'm going to be a better person. How did you emerge from this?
Um, how did I emerge from it? I definitely,
Meaning, is your perspective different? Is your outlook different?
I will definitely say that I'm very aware of, in a very scary way, that I can get sick. And I didn't know that.
Well,
I
facing your
didn't
own
know
mortality
that
is
I
a
could get
huge
sick.
thing. Right.
I
It's a
didn't know
huge
I
thing.
could be laid so low. I
Right.
didn't know I could be so vulnerable and some days be so weak that I just wanted to weep. I didn't know that. I didn't know that, those things. So on the other side of it, I think I when I feel good now, when I feel healthy, I feel a deep gratitude for that. I feel I want to safeguard it, and I've always invested in my health and taken care of my health. So I never think that I did something wrong to get cancer. I don't know why I got cancer. It wasn't because I
I
was.
don't know why you got cancer. We don't know why most women get cancer, but you said it, it's nothing you did or didn't do.
Yeah. So, I mean, I continue to exercise. I continue to try and eat well. I try and meditate. I try and take care of my mental health. And every thing that I can take care of, I continue to take care of. And when I feel good, I just feel deep gratitude. And to circle back on the gratitude, when I was telling you about the women that I would meet, they would tell me their experience. And unfortunately, not many of them shared my experience, that the care that I received. They did not receive that care.
I would
And
like to
that is
say that
so sad.
yeah, I would like to say that I'm surprised, but I'm not. I think that we go above and beyond, and part of it is breast cancer is so personal to me. Um, I have, as you know, and I'm open with sharing, a very strong family history of breast cancer, and have seen different levels of what I would consider good care. And I'm not saying the technical aspect of surgery or the exact chemotherapy that they got, just overall care of them as a person going through breast cancer treatment. And I have always wanted to do better than they have received. So it's a very personal thing. And I think that my patients feel that it is something really personal to me. And it is what makes me a better doctor and better at what I do.
And yes, and I didn't know that this
Oh.
wasn't standard until every person I spoke to, they were like, "Your surgeon called you?" I was like, "Yeah, she just kept checking in. How are you doing?" And if it wasn't the surgeon, it was someone from her staff checking in, and all different, I never felt alone. I never was, questioning, will I get through this with just myself? I had so much support, yes, from my family and friends, but from you, Dr. Boolbol, and your staff. As you know, when we all get sick, we go right to WebMD.
Dr. Google.
First decision. I went once and I was like, oh my gosh, this is terrifying. If I have any questions, I'm going to Dr. Boolbol. I'm not looking here. I have no idea what all these terms mean, this type of cancer, this treatment, this. I have no idea. All I knew is that I was filled with fear with what I read. And then I
Right.
just spoke with you and you're like, okay, well, here's what we have going on here. And here's how we're going to take care of it. And it was one piece at a time. So from sports, if I was teaching someone basketball, I don't, try and teach them, super game strategy and all those things. It's like, we're going to make a layup. All right. We're going to just take the ball right off the glass, shoot for that little corner. And I love that was your approach to my treatment and my cancer and my recovery. Here's our first step. And that's really, you told me what, a little arching, not a lot of color in there, but here's how it's going to look over. But here's our first step. And you know what? I'm going to call you in a week. And then you're like, you know what? You're probably moving to this step now. So it was also with gentleness, and it can be overwhelming, if especially with treatments, you're like, oh my gosh, I have to do all this chemotherapy treatment was horrible, and I have to do all of these other ones. This radiation is horrible, and there's more to come. But it was like, you know what, one day at a time, and we're going to get through this. And it's always you're doing great, and not like like this is working, doing great. It wasn't like, oh, you're fighting and you're doing this great. You're like, everything is great. So just that infusion of confidence and optimism, I think is a certain type of medicine. And it's genuine and it's real when you do it. There's I watch your body language, I watch your eyes, I watch your demeanor, and the sincerity and the belief, and those things are true. And if you're telling me that with all your experience, with all of the patients that you've seen, and sometimes the outcomes are not what we, hope. So with all that, that you could stand in front of me and say, we got this, gave me a tremendous amount of trust. I believe you, and that, like you're saying, when someone puts I 100% put my health into your hands, and I believed and trusted in you.
Yeah, I mean, it's a huge thing. And I think it's critically important in life, but also in medicine, is to just be honest with the patient. And I was honest with you every step of the way, not always giving the news. And I say to patients frequently, does this make sense? Do you understand it? It doesn't mean you like it. You didn't like any of this, and no one does. But understanding it is critical. And I always think, if I'm thinking something, you deserve to know it. If I'm worried about something, you deserve to know it. It's your health. Me sugarcoating doesn't help anyone, but there's a way to deliver bad news. I remember the day I had to call you and tell you needed chemotherapy. It wasn't good news. It certainly wasn't the news that you wanted, but calling you saying, okay, this is the result of the test. We know based on this that you need chemotherapy. This is what it's going to look like. And here's your appointment. So giving it to you so that it's not, what's the next step? Where do I go? Who do I call? It's everything wrapped up for you. You certainly didn't like the news. I certainly didn't like giving it to you. But based on the technology and the testing that we have, we know that chemotherapy will make a difference to your outcome. And that's why you did it. But if that's not explained to you, it's hard to understand, why am I going to go through that?
Exactly. And I think the delivery, when you have to deliver bad news, perhaps on your part, you delivered it just like you deliver bad news to your kids or to your partner or to your grandparent. You delivered it in such a way that there was a cushion of feeling in there. You didn't lean back into, well, this is just science and I'm a doctor and you should. It was like, how are you doing? I have a little bad news. I don't even know if you said a little bad news.
I didn't say that, because it's more than a little bad news.
But it braced me, and it just the conversation. It took a little processing, but that was the start of the processing, and that it made all the difference in the world. We're going to do this. Here's some bad news. Here's a little setback. We didn't anticipate this, but here's what we're going to do. And this is how we're going to get through it. And that is why from Long Island, I drove, I don't know, 4 hours to be with you, to be with your Vassar, to be with your staff, to be with that. So many people like, oh, I'm just going to go local. Oh, this is convenient. It won't serve your healing. It won't serve you. It's not. It shouldn't be a choice of convenience and what is nearby. It is. You have a special way. You really do, and it's reflected in your staff. Whether it's how you hire your staff or how you educate your staff, but it is a common thread throughout the staff. So I'm going to guess that you handpicked everybody that works for you. I don't know if that's true, but I know that it's not a mistake. I've been in I've seen it with other family members, the inconsistency of a staff, like this one's over here, this one's this and that, right through the common thread was empathy and a deep caring of and I'm the patient of the patient. I felt that way.
Right. And it's a philosophy, and you have to believe it. And it really is dealing with breast cancer. It's a special calling, and you have to believe in treating each patient individually, and the support is critically important. It's interesting. One of the things that we see is patients expect to be depressed with that news. I think that your reaction of crawling into bed was completely normal, but you didn't stay there. You were like, okay, I've allowed myself this time. Now I have to act on it. And you did pretty quickly. But what we find is after a woman goes through the treatment, whether it's surgery and radiation, or surgery, chemotherapy, radiation, whatever it is, at the end of that, that's when we see depression set in. Because, and we've had this conversation, because you've almost been on autopilot. It's go here, the support's there, your community, your family, your friends are rallying around you. And when you're done, they're like, okay, everything's good. It's all back to normal. They go back to their lives. You're not at the doctor's as frequently. And that's when the processing of it starts. And you're like, wait a minute, I'm not back to normal. What's normal now? I've had breast cancer. I've gone through chemotherapy. I've lost my hair. Who can say that I'm back to normal? I'm not. And the question is, at that point, the support at times, I believe, is even more important to say, hang on, we need to be here. But your community doesn't know that, because they're on to the next friend and family member who needs them. So how are you doing now, having been through all this?
Well, thanks for asking. So I guess it was 2020 when I first, was diagnosed. And then going through the treatments, which were probably 7 months.
About that.
And then people would say, oh, you must have a new lease on life. It was after the 7 months, I'm going to say it was 8 months. And I'm being small on that, to continue recovering. I didn't feel like myself.
Right.
So everyone's like, oh, you beat it, you did this. And I'm like, actually, it's still kicking my butt, if you want to know the truth. And I would, I became very reserved about that. And then at a certain point, I became depressed. And
I remember warning you about that, because, and it's interesting, there's no great literature. As physicians and scientists, we rely on the literature for so much of treatment. But when we get into this area, there's not a lot of literature. And it's, my experience in doing this for more than 20 years, that's when we see depression set in. But patients don't expect it. So it makes them more depressed. They're like, I'm done with treatment. Why am I depressed now?
Yeah.
So we try to warn people that look out for the signs now, because that's when we see it.
Yeah. And that depression, it lasted a while. Was super reluctant to take any medicine for that after taking putting all those chemicals in my body. And one thing maybe from athletics that I know, if I went through an extreme season, a high adrenaline, up, down, tension, stress, all of that, I would go into a low, like, and the depression was a recovery, mental kind of
Right.
just like, you're going to go right here. So that's the only thing that I used moving through the depression was like, you know what, your body wants you to go way down here. Don't go in a dark place, or try not to, but look at this depression as your body just like, but that depression, it did lift. But that was not, these things are, they take time. And
It's a long time,
process is
longer than
time.
people expect.
Yeah. And even when I'm feeling great now, it is there, I do have fear.
Mhm.
Um, and it's less. Sometimes I would wake up, like I would be startled right before I fell asleep, and I would have fear, like, and maybe I didn't express or go through or talk about enough fear that when I was going through the treatments and things or how it was affecting my body, maybe I didn't talk about it enough. But that was like a psychological aftermath of the treatments when I was done, was on that cusp of falling asleep and waking up. Sometimes like you feel like you're falling, but I would feel like I was falling with fear, and it would
Right.
shock and scare me. And I
And it's
don't
a
think
lonely place. Fear
it's
is a
very
lonely
lonely.
place. It really is. No matter how you look at it, whenever fear is present, it's a lonely place.
Yes. And like, who else except you could I talk about with that? Because if you don't have, if someone told me that, I'd be like, I wonder why. You want me to turn on a nightlight? I mean, what's wrong? What are you afraid of? But it was some type of reaction psychologically from what had happened, some
Right.
post-traumatic stress or something
It is.
that, yeah, that only I could tell you. Like, if you ask me my experience and what happened, this is one of the few times I'll talk about that. It's with you. But other than that, that was like, another lonely place. Like, you have to do some stuff on your own. And even with other cancer patients, everybody is different. Everybody
Everyone.
handles things differently. And some things, I remember my sister Lori telling me about childbirth, and she goes, yeah, I never tell anybody how horrific my child, birthing was, because why would I want to give them further fear? It could be a smooth birth, it could be horrible. She goes, it's not a service to tell people
Right.
that are already pregnant, this is going to be
What's going to
a
happen?
nightmare. So I thought about that. So I'm even with someone that tells me they had cancer, what can, I wouldn't fully say what you can anticipate because you don't know. And I
Right.
think I take a little bit out of a page out of your book and just say, well, one step at a time, and get yourself not just the best surgeon on paper, but look in their eyes and feel them, and know this is as important as any life partner you're going to pick as far as your life is concerned. Make sure you trust that person and believe in them. It is a human connection.
It really is. Well, I'm thrilled that I could be part of this journey that we call life of yours. And, you know, it it's a special thing, again, to have you trust me with your life. And I am thrilled beyond words that you're doing so well, but it's a process. It's like anything in life. It's a process. It is just one day at a time. I mean, it's a story of how we all get through life, never mind each really hard uh, experience that we go through. And this was a hard one, but I thank you for letting me be part of it.
Thank you, Dr. Boval. And it always reminds me to say, I love you going through this, because you want to make sure you tell people that you love. And thank you. I love you. Thank you for taking care of me.
Thank you.